Well, as a plastic surgeon, we are called upon a lot of times to take care of a variety of different issues with regards to breast surgery. I would say that the main categories would be breast reduction. Second category would be breast reconstruction after cancer. And then lastly would be cosmetic breast surgery. So for breast reduction surgery, I would start by telling you it's probably one of the most satisfying operations that we do as plastic surgeons, primarily because the satisfaction rate is so high for our patients. A typical candidate interested in breast reduction would be a woman the volume of their breast simply has caused them significant symptoms. The typical symptoms we see would be sort of upper back and neck discomfort, rashes that can develop underneath the breast, inability to exercise and find appropriate clothing are some other complaints that we hear. So the process typically begins with a fairly detailed consultation actually in our office. We go through the risks and benefits and that sort of thing. We have to make a lot of documentation, primarily for the insurance companies. We make a number of measurements, etc., and try to help the patient determine if this is a good operation for her. The operation takes us about 2.5 to 3 hours to complete. Typically it involves an overnight hospital stay. Not a whole lot of discomfort actually. I'm always impressed really how well people do the next day. And then quite a bit of follow-up afterwards in the office, making sure everything heals up just right. And then typically people are back at work within a week and a half or so, depending upon the type of job that they do. Well, I would tell you it's so fun to see patients, especially when we get to 3-6 weeks out from surgery, because I can't tell you how many times I've heard, I wish I had done this sooner. So breast reconstruction surgery is also very satisfying for us to help patients get through that whole difficult process. And typically we can help with other surgeons and other medical specialists to take care of these patients, because after cancer surgery you're often left with some sort of defect or what have you after the surgery's been done. So we can come and try to help rebuild the whole person and give back some self-esteem to these patients. The process is very intertwined with other specialists, and we have to work very closely with our colleagues to time the surgery correctly and help the patient choose the right option for her. But I would tell you that's the most exciting point from our standpoint in terms of plastic surgery, is that we can give that patient choices. You have two main categories of choices in terms of breast reconstruction. The first one would be to utilize some sort of implant. And the second choice would be to use the body's own tissue to try to recreate the breast. And so the recovery is going to vary a little bit upon which of those choices you make, but there's certainly no one right or wrong answer, just sort of whatever is tailored for that particular person. And also the recovery is going to vary a little bit, I guess, on each of those choices. So, but it can be extremely satisfying to have a woman walk back into the office wearing the same clothes that she had on before the surgery and that sort of thing. So, the last category that we treat in terms of breast surgery as plastic surgeons will be cosmetic breast surgery. And actually, even males are involved in this process sometimes. Typically, at least in my practice, I'm seeing two main categories of women who are interested in breast surgery cosmetically. Number one would be women in their 20s, 30s, 40s who simply want to increase the volume of the breast that they have. It can be very satisfying in terms of self-esteem and just give people more confidence, really. And the second category would be women in their 30s, 40s, 50s, maybe even beyond, who maybe they've had some children, and that whole process sort of leads to some extra skin sometimes on the breast, and that can be addressed as well through cosmetic surgery. And for the men, sometimes we can reshape the breast if you dislike the contour of the chest with a variety of techniques. So. Well, first of all, whenever we accept a new phone call to our office about a breast procedure, we really encourage people to bring a friend or a family member. I think that helps a lot to help get all the questions answered and understand the process. We just want to try to have a relaxed atmosphere and help the patient to understand what goals are achievable and what to expect in terms of recovery, and we never want to oversell a procedure, so we find that very important in our practice. Well, the nice thing about being in a big group of plastic surgeons is that we have a lot of staff around our office that can really help patients get through any little question or big question that they have 24/7. So We have a nurse educator that's dedicated to helping patients understand the pre-op and the post-operative phase as well. It just is an extension of our practice in that way. I think some of the most common misconceptions about breast surgery of all types really would be, number one, what cup size am I going to be after surgery? And I'll tell you, it's virtually impossible to really predict that. At least it gives us a common ground that we can speak on. But the problem is it depends on the bra manufacturer, and also sort of how you wear the bra. And so we never want to guarantee you'll be this cup size. But we can help the patient to kind of choose a size that would match the rest of her figure as well. I think another common misconception with regards to breast surgery really has to do with breast implants. These are probably the best studied medical device on the market. And there's been all sorts of issues and thoughts brought up over the years. But they're now in what we consider the 5th generation, and so they're very, very safe devices. They're still not lifetime devices though. And so the one guarantee that we can make is that at some point in your life you'll probably need to have at least some other kind of surgery to either exchange the device or adjust it in some way. I think one of the main advantages to bringing our breast reduction and breast reconstruction patients to Shawnee Mission would be the fact that we do such a large number of these kinds of cases here, that we're just so well versed and we can communicate together as a team, particularly the nursing staff on the medical surgical ward and the short stay unit. They really are geared into taking care of these kinds of patients. I'm Dr. Paul Leahy. I'm one of the plastic surgeons here at Shawnee Mission Medical Center.